Well, the past couple of years, many people put off getting annual physicals and screenings. Now it's time to get your health back on track. Today, we've got nurse practitioner Richard Morrow with LeBauer Healthcare at Summerfield Village. He's here with us to kind of review the screenings that you need most and why do you need them. All right, let's start with how important the annual physicals or wellness checks are.
Yeah, the annual physical is an essential portion of health maintenance. Annual physicals are key in early detection and prevention and just touching base, making sure that we can take these early steps to get your health on track and prevent anything bad from happening.
Okay, and I think a lot of times people they think to themselves, I just feel fine. I don't really need to have this done. Why do we need to go every single year?
Right. I hear that a lot from patients. Why do I need to have this lab work done? Why do I need to come back in to have my blood pressure checked? Well, you might not feel your blood pressure if it's just a little bit too high. You probably can't tell if you have high cholesterol, but you certainly can tell if you have a heart attack or you end up with other adverse health events later on. By taking these steps at these visits regularly, annually, or even more frequently if you have health concerns, we can hopefully head off any of those adverse events before they happen.
All right, and so who needs the wellness check? Are we talking about kids only because they're changing so much and growing, adults, both?
Everybody, everybody should come in at least once a year to their primary care, a family doctor, their internal medicine doc, whoever they see on a regular basis, just to make sure that everything's still going smoothly. It's certainly, like I said, sometimes it's the things under the hood that you just don't notice, and those are the things that folks in primary care like myself are trained to pick up on.
Okay, so that's the primary care doctors, but a lot of adults have kind of gotten off schedule with their screenings as well. We're talking mammograms, we're talking colonoscopies. How concerning is it that people have kind of like been going away from those types of screenings?
Yeah, it's very concerning. It's very concerning. Certainly, COVID's been the hot topic over the past few years, and that, doesn't necessarily mean that colon cancer or breast cancer has gone away. Certainly, nobody looks forward to a mammogram or a colonoscopy, but it's crucial to get early detection on board. It's early detection and early intervention in these disease processes is a huge determining factor in how successful treatment will be.
All right, let's talk about some of the do's and the don'ts kind of thing, the health checklist. We're going to go down men, we're going to go down women, we're going to go down children. I know we all have some of the same things, but there's some different things too. How about for men?
For men, certainly want to make sure colon cancer screening is on board for folks 45 and older. For folks 50 and older, recommend prostate cancer screening. Then, of course, routine labs, things like blood counts, liver and kidney function, cholesterol checks, certainly things that we want to keep an eye on.
All right, and then let's go for women.
And for women, of course, mammography every year is typically recommended, certainly sooner if there's any abnormalities. Cervical cancer screening with their primary care or women's health specialist every 5 years for normal results from anybody from the ages 21 to 65. And then bone density screenings for women in postmenopausal age range or women who are at higher risk for fractures.
All right, and then let's talk about our kids. I mean, I think we take our kids to the doctor, like if they need a certain like immunization or, if something is wrong, but not anytime else.
Right, and certainly kids are always tough. Kids have a tough time vocalizing their concerns. Sometimes it's easier for them to speak with healthcare providers and speak with those of us who are more in tune with the way kids tend to talk about their health concerns. Certainly, regular vaccinations still crucial for children. Certainly, things like meningitis haven't gone anywhere. Things like HPV are still causing health concerns in our children and young adult populations. So certainly important for those folks to stay regularly in touch with their primary care provider.
All right, so you got families at home who are listening to this. Maybe they're thinking, all right, I got some things on my checklist I need to do. I know the husband or the kid has something on their checklist, and they have not been doing these wellness checks. Where do they start again? What should they do?
Find a primary care doc that fits your needs. Certainly I understand it. I think everybody knows the sort of intimacy in healthcare and how important it is to find somebody that you really gel with. And so, make that search, take those steps. Conehealth.com/appointments is a great place to start. That will guide you through providers that are accepting new patients, offices that are accepting new patients. Once you get in with a primary care provider, remember, it's better late than never. Certainly, I know folks have sometimes concerns that it's been so long, and Well, how do I get back on board? Make that appointment and come on in. We'll take care of the rest.
All right. I do want to talk about the prevalence of like heart disease, especially since we're in that month, but we're going to take a quick break first. But we want you to know, folks at home, that we're going to be talking about heart disease since it is this month, and we'll be back in just a few moments.